Prefabricated Pontic. Prefabricated Pontic is a pre-manufactured artificial tooth used to replace a natural tooth within fixed partial denture. Prefabricated Pontic consists of facing, which is the aesthetic and visible part made up of porcelain or resin, and metal backing, which is the structural component that attaches to the rest of the bridge. In most cases, facing contacts the mucosa passively except interchangeable facing. Trupontic. Trupontic has large gingival bulb and a horizontal tubular slot running in center of the lingual facing. It is indicated in cases where there is limited interarch distance. Disadvantages: it cannot be used in cases with reduced interocclusal distance. Interchangeable facing or flat back facing. Here the facing is retained by a backing with a lug which is designed to engage the retention slot. This is the vertical slot. Here backing contacts the mucosa passively. Disadvantages: this design causes plaque accumulation and also gingival inflammation, and also it is a complex design. Pin facing. It has flat lingual surface and two retentive pins. These pins are used for retention. It is indicated in cases with reduced occlusogingival height. Reverse pin facing. These are precision holes which are made on the lingual surface of facing to aid in retention. It is indicated in deep overbite cases. In this Pontic, the backing is fabricated according to facing. Harmony facing consists of flat lingual surface with two retentive pins. Here, gingival bulk is a custom fabricated by Porcelain, is added to the ridge, glazed and then finished. Disadvantages: it is not indicated in cases where there is decreased occlusogingival height. Porcelain fused to metal facing. It consists of metal core over which porcelain is fused to closely resembles the contours of natural tooth. Avoid contact of metal porcelain junction with tissues. This is metal backing. This is metal of the facing. And the outer layer is ceramic which is fused to metal of the facing. All these three layers forms porcelain fused to metal facing. It is indicated in anterior teeth for aesthetic concern. Sanitary facings. It resembles sanitary pontics. These pontics have slots which is present on the proximal surface to fit into metal projection, and the facing has a flat occlusal surface which is customized as needed. Pontips. It has convex gingival surface that favors attachment of pinpoint tissue contact. It is made up of glazed porcelain and attached to the backing with the help of two retentive pins. This is convex gingival surface. These are Pontic modification. It is used in cases with large gingival embrasures, so-called black triangles, for better aesthetics. Special Pontics. First one is Quinns Pontic. It is a two-piece Pontic system. The lower one is lower inner core. It is used for permanent gingival porcelain with stump, and the upper core can be cemented during insertion. Lowery Pontic. It is a two-piece Pontic system with porcelain on top and metal on bottom. The metal joint is designed like a key which runs horizontally, and the gingival portion has a very thin line of tissue contact. It avoids thin porcelain margins. Schwartz Pontic. Here the facing covers the entire gingival surface with large pins. Metal backing stops at upper half of the tooth. Hidden attachment Pontic. These Pontics are customized with an attachment to retain RPD. Notch Pontic system. Here there is a lingual slot to engage wire or fibers. It is indicated with Invisalign appliance. In this appliance, it has to be reconfigured and shaped as the tooth movement occurs. And also temporary FPD, fiber reinforced FPD. Aligner orthodontic Pontic. It is not used in FPD but to aid in tooth movement along with Invisalign appliance. This is a Pontic. Pontic clasp. It is a modified clasp with a small tooth-like morphology to fill spaces in RPD. If you found this video helpful, don't forget to subscribe and hit the bell button so you never miss a lesson. Thank you. And stay tuned for next video. It is about Pontics based on mucosal contact.